And as the coronavirus continues changing so much, we wanted to pause tonight, take a little breath, and get a refresher on some basics.
Just what is the coronavirus? How does it affect people? And who is most at risk and why? We wanted CBS 4's David Sutta to explain everything tonight, and he joins us now live. David.
Yeah, we're just off the newsroom here in a very familiar site here, the bathroom here where we're washing our hands. Obviously, you've been hearing a lot about washing your hands and doing this for about 20 seconds, enough time to sing the happy birthday song twice. But tonight we're taking a closer look at all this as to why you're doing this. What is it exactly doing?
It's known as COVID-19, CO for corona, VI for virus, D for disease, and 19 for when it was discovered. Coronaviruses are actually a general name. They are the cause of the common cold, the flu, and deadlier outbreaks like SARS or MERS. Like those viruses, COVID-19 is transmitted most commonly through respiratory droplets produced when an infected person coughs or sneezes on you. According to the Center for Disease Control, the virus can live on surfaces for extended periods of time. However, the CDC has yet to have a case that came from someone touching something. All confirmed cases so far have been linked to direct contact with another person. Symptoms for COVID-19 typically appear 2 days to 2 weeks after exposure, which is why you hear people quarantining themselves for 14 days if they've been exposed to someone with the virus. Symptoms include fever, cough, and shortness of breath. If you test positive for the coronavirus, you may be admitted to a hospital or be advised to self-quarantine yourself at home. It depends on the severity of your symptoms.
A majority of the cases are cough because the virus is in your nose or throat. But if it makes its way down to your lungs, well, that is when it gets dangerous.
The virus began in China, and the World Health Organization has done extensive study on the outbreak. Of those infected in China, they found 80% had mild to moderate symptoms, including pneumonia. Nearly 14% had severe symptoms with respiratory issues. Roughly 6% had critical outcomes with respiratory failure, septic shock, and/or multiple organ dysfunction and failure. The data shows children are remarkably resilient to the virus and typically experience mild symptoms. For seniors, it's the opposite. It can be deadly. Also, those with immune system issues or chronic medical issues like heart disease, diabetes, and lung disease are at great risk as well. So how do you avoid the coronavirus? Yes, wash your hands often. Do this for at least 20 seconds. Do this every time you're in a public place, blow your nose, cough, or sneeze. And if you cannot wash your hands, use hand sanitizer with at least 60% alcohol. And always avoid touching things in public and touching your face.
Lastly, let's talk about those masks. You see people starting to wear them in public. Well, the masks are actually for the people who are sick, or if you're around somebody who is sick. You put the mask on, it obviously keeps the cough and the sneeze from being projected out. And if you're healthy, you're not necessarily supposed to use that, but some people now electing to wear that because they don't know who's around them may be sick as well. With the very cleanest hands here in CBS 4's bathroom, we'll send it back to you in the studio.
We definitely appreciate that. David, thank you very much. And if you have more questions concerning the coronavirus, Florida continues manning a hotline that's open 24/7. The phone number right there on your screen. There's also an email address you can send questions to. It is covid-19@flhealth.gov.